People assume eyelid surgery is just about looking younger, but most patients I meet are actually trying to fix something specific that's bothering them every day, and they're not always sure which eyelid surgery they even need. I'm a facial plastic surgeon, and I see confusion around this all the time. When patients don't understand the difference between an upper and lower eyelid surgery, they either delay care they actually need, or worry themselves into unnecessary fear about recovery and results. By the end of this video, you'll clearly understand what upper versus lower eyelid surgery actually does, how recovery differs, and how to think about which one is relevant to you. Let's start with the big picture. Upper and lower eyelid surgery are completely different procedures, solving different problems, even though they're often grouped together. Upper eyelid surgery is typically about excess skin. Over time, the skin of the upper eyelids stretches and folds. In some people, it creates a tired or angry look. In others, it literally weighs down the eyelids and interferes with their vision. This surgery removes extra skin and reshapes the eyelids so the eyes look more open, alert, and rested. Less common forms of upper eyelid surgery are Asian upper blepharoplasty, where the goal is to create a defined double eyelid. Another less common upper eyelid surgery is ptosis repair, where a person has a lazy eye that droops down, not from excess loose skin. Now, lower eyelid surgery is not about skin hanging down. It's usually about puffiness under eye bags or hollowing that makes people look exhausted, even when they feel fine. That puffiness is often fat that has shifted forward with age. Lower eyelid surgery repositions or removes that fat and smooths the transition between the eyelid and the cheek. Patients often ask, do I need both? And the answer is, not usually. Many people only need one, and doing the wrong one won't fix the problem that bothers you in the mirror. A more important question I always believe is to ask you what bothers you. It's common I see patients who have both, but only want the excess upper eyelid skin removed, and vice versa. While I'll tell them they'll get a much better overall result if both are addressed, not everyone wants both. Another common question is about recovery. Upper eyelid surgery tends to be easier for most patients. Swelling and bruising peak early and improve steadily over 1 to 2 weeks. Most people feel comfortable being seen in public fairly quickly. Lower eyelid surgery might take a little longer. The swelling sticks around more and bruising can travel because of gravity. That doesn't mean something went wrong. It's just how the lower eyelid heals. Final refinement takes patience, but the improvement is gradual and natural. Patients also ask, does this look obvious? When eyelid surgery is done correctly, the goal is not to look operated on. The goal is for people to say you look rested, healthier, or less tired without knowing why. Another big question is it permanent? Eyelid surgery does not stop aging, but it resets the clock. Most patients enjoy the results for many years because the changes address structure, not trends. The biggest fear I hear is this: what if I don't look like myself? That fear makes sense. Your eyes are central to your identity. Good eyelid surgery isn't about changing your eyes. It's about uncovering them, removing what time has added, not adding something artificial. When done thoughtfully, you still look like you, just less weighed down by excess skin or puffiness. Here's the takeaway. Upper and lower eyelid surgery aren't interchangeable. They solve different problems, have different recoveries, and require different planning. The right choice depends on what's actually causing the tired or heavy look, not what procedure name sounds familiar. Good care isn't about rushing into surgery. It's about understanding your options early and choosing the one that fits your face, your concerns, and your timing. If this helped clarify things, that's exactly the level of understanding every patient deserves before making a decision.